Ladies and gentlemen, we are still struggling to win this fight against our single common enemy, COVID-19 or coronavirus. The Swiss Federal Office of Public Health has published new additional measures and information for us to follow and abide by. Kindly visit bag.admin.ch for latest updates and changes. Diaspora-TV Switzerland is pleased to present most of them to you. Staying at home is still highly recommended as a preventive measure of slowing down the spread. When staying at home, do not forget that you need to do some movement and get fresh air as well, either on your balcony or in your garden if you have one. It's also important for your children to have a moment in the park for a short time in a day. First, let us have a look at some important facts about the transmission. The virus is transmitted when you have contact with an infected person. This is why the 2-meter distance is very important. These are the two most common ways of transmission. Droplets from an infected person when they sneeze or cough too close to you. When you touched an active virus-infected surface with your hands. This is why you are advised to avoid handshakes because the virus can get into your system when you touch your face, nose, eyes, or mouth. So washing your hands regularly is very necessary. The symptoms of coronavirus varies from one person to another. Some have mild symptoms and others strong symptoms. This depends on several factors such as the immune system, age, most especially people above 65 years, and also others with known and unknown sicknesses. If you already have other sicknesses or diseases such as high blood pressure, cardiovascular diseases, diabetes, cancer, or existing respiratory problems. These are the symptoms published by the Swiss government that everyone should be aware of. If your cough is dry, this means no mucus, no wet fluids when you're coughing. Sore throat. This means you have pain in your throat. Difficulties in breathing. When your body temperature is higher than your normal body temperature and if you're feeling feverish at the same time. If you have muscle ache, which means abnormal muscle pain. Loss of sense of smell and taste. All these symptoms could lead to pneumonia, which is an infection in one or both lungs. If you experience one or more of these symptoms mentioned, the Federal Office of Public Health advises you not to rush immediately to the hospital as long as your general state of health is good. However, you have to self-isolate at home immediately for at least 10 days to prevent infecting other people. If after 10 days you feel better, kindly add at least 48 hours of self-isolation to be 100% sure that you are COVID-19 free. Please inform everyone living in the same household and people with whom you have been in close contact with about your health situation and advise them to self-quarantine. This means they should stay away from everyone else for at least 5 days in order to be sure if they are infected or not. The following instructions explain what measures you should take to avoid transmitting the virus during self-isolation. Monitor your health. Call a doctor immediately if your respiratory system deteriorates. For example, if you have difficulties breathing, please save your life and act quickly. So therefore, if you need to go and see a doctor, kindly wear a face mask. If you don't have any mask, cover your mouth with other materials and keep a distance of at least 2 meters from other people. If you live alone, ask family members, friends, or a delivery service to deliver groceries and other essential products such as medicines to your home and to leave them outside your door. If you live with others in the same household, stay in your room and keep the door closed. Eat meals by yourself in your room. Avoid any visits or contacts and only leave the room if absolutely necessary. Keep a distance of at least 2 meters from other people. Avoid contact with pets. Clean all amenities like shower, toilet, sink, bathtub after each use with a standard household disinfectant. Do not share household items such as glasses, cups, or kitchen utensils with other people. Wash these items carefully after use in the dishwasher or by hands, using washing up liquid and very hot water. Do not share towels or bed linens with other people. Wash your clothes, bed linens and towels separately and in a washing machine with at least 60 degrees temperature. All rooms should be ventilated regularly, as the virus can also stay in the air for some time and not only on surface. This advice is for parents. If your child is in isolation, it's a good idea to appoint one person in the household to look after the child. It's recommended that the whole family remains in quarantine if possible, especially those with several children. Please follow the self-isolation rules properly. These are some of other things we should keep in mind. Remember, coronavirus is not the only health challenge that we have in our society. If you or your child is suffering from other diseases or illnesses, even if it's not related to coronavirus, you can still go to the hospital to see the doctor or go to the emergency service. Kindly call before going. The Swiss hospitals are well organized and safe. You do not need to fear that you will be infected by coronavirus. Most hospitals do refuse visitors at the moment to protect the patients and staffs from being infected, but you can still call or send a message to your family and friends who are hospitalized. Help us to protect the elderly. Think about them and call them more frequently to see how they are doing. If you have to visit them, keep the maximum distance as much as possible, at least 2 meters, and avoid any physical contact. If any elderly person or a person from the risk group lives with you, be aware that you can transmit the virus to them. So take all the necessary precautions and limit contact with others to prevent them from getting infected. When too many people are infected by coronavirus and fall ill at the same time, the hospitals risk not being able to treat all seriously ill and critical cases. Therefore, it is so important that you slow down the spreading of the virus by applying these measures. The whole human race is trying to win this fight, but we are not yet done. We still have a long way to go, but together we shall reach our destination. Everybody is needed. Do your best too. Thanks for sharing with others.